So before medical training, before I did family medicine and functional medicine, I just loved exercise. That's what got me into health. I've done just about every form of exercise, CrossFit to coaching CrossFit to doing small group boot camp training. And over the years, my approach to exercise has really changed a lot. And I think having kids was part of that, because now I think about, okay, how do I run around with them when they're 16, or my grandkids, or how do I still beat my son in a sprint when he's 18 because I need to kick his butt or do more pull-ups than him? And so those are the things that change how you approach exercise. It's about the long game, right? And I think that's why we're all here at Essential Health. I'd love to ask everybody, just get some participation. If you all had to pick one form of exercise that you think is the most important for longevity, whether it be cardio, strength, or stability and mobility, what would you choose? It's probably the one you're not doing, right? Because they all matter. There's evidence behind all of them and why we need to do it and why it makes us live longer and live better. But if you focus all on one, you're gonna neglect the others, and that can cause problems itself. So it's about balance, and hopefully we'll provide you with a framework for how to exercise efficiently. But cardio, so off the bat, we had some people who picked cardio. It is really important, I'll give you that. There's two main components that we should focus on with exercise. So one is the long, slow, steady cardio, zone 2 training and performance. There's different zones for intensity. And zone 2 is that heart rate that's 70–80% of your maximum. It's something where you could have a conversation even though it's uncomfortable and do. But this form of exercise is really, really important. It does so much for us, from increasing BDNF and neurons in our brain, preventing cognitive decline, strengthening our mitochondria. It's a way to pull glucose into our cells and lower blood sugar over time. And it just makes your engine bigger. So doing day-to-day tasks, running around with kids feels easy because you know you could go out and do an hour of zone 2 training. And even when I was at the Cleveland Clinic and spending time with some of these brain health physicians in their clinics who were just seeing patient after patient after patient with cognitive decline of different diseases, their number one recommendation across the board was exercise. Everyone. That's how powerful it is, and even conventional medicine recognizes that in a lot of ways. So it's something that I encourage everyone to do. And the question always comes up, how much do I need to do? And if you're doing none, then the answer is, well, some is better than nothing. That's gonna help. But if we're shooting for optimal, you wanna be a rock star, well, probably aiming for 3 hours a week is really the goal, which sounds daunting, right? But remember, this is kind of not the super painful form of exercise. You can grind through it, you can listen to a podcast, you can watch a movie. This can be a hike through the woods, right? This could be walking around your neighborhood with some weight on your back to get your heart rate up. It could be riding a bike, it could be rowing. There's so many forms to do it, but getting it in, doing it frequently, it's huge, it's really important. On the other end of the spectrum is gonna be the high intensity exercise. We call it VO2 max training. VO2 max is a term we use to describe the amount of oxygen someone can use at their most intense exercise. So someone who's really fit can use a lot of oxygen, and they can turn that into energy, and they can crush workouts and perform. Someone who's not so fit, they struggle to use much oxygen. They get to a point and they can't use any more, and they're done. And so we can measure this. And this is arguably the most powerful marker we can use for longevity. There's an interesting study in 2018 out of JAMA that looked at people of different age groups, and it mapped out their VO2 max across the board. And they found that people who had the lowest quartile, so 25% or less VO2 max, had a 4 times increased mortality rate than the top quartile, which is crazy to think about. It's just, 4 times, okay, whatever. But if you really think about that, that's a 400% decrease in mortality, right? Smoking increases mortality by 40%. So puts it in perspective. The good news is VO2 max is trained by zone 2. So if you're doing that cardio, your VO2 max will get better. But probably also want to consider adding in once a week one form of high intensity exercise where your heart rate does kind of get close to the maximum. And one of the best ways I think to do this, and one of the ways I like to incorporate it, is in some form of circuit training where you can do hard work for 3 or 4 minutes, get your heart rate really jacked up, then let it recover for 3 or 4 minutes, and then go at it again and do 4 or 5 cycles. And so that's a great way to see where you're at. At Essential Health, we don't measure VO2 max per se, but we use a different way to measure it with a step test, measuring your heart rate before, right after exercise, and then with a minute recovery. And it's a good proxy to see about what your VO2 max would be. And so it's something we keep an eye on for patients because it's really important. Strength is my favorite. I think the reason a lot of people raise their hands for strength is because we harp on this so much. And that's mostly because when people think of exercise, they think more of cardio. And strength, at least in our culture, often gets more ignored, especially for women, especially for people as they get a little bit older. It's thought of as like the young men's thing to lift weights. But if you come to see me, if you come to see Dr. Elizabeth or Dr. Jay or any of our other providers, Dr. Tanya, they're all gonna say you need to strength train because it's so important, and I recommend it to everyone. So why is it important? Number one, it prevents falls as we age. And that's well shown in research. And what's kind of a shocking statistic is after the age of 65, if someone falls and fractures their hip, what do you think the 1-year mortality is? 35% in some studies. A third of people die after breaking their hip within a year, which is, it's crazy to think about. But we focus on heart disease, we focus on cancer, right? We focus on lung disease. But if someone does all those things perfectly, but they have thin bones and they trip off a curve and then they die in 2 years, you know, we've lost the game. That's why strength training now is so important. So preventing falls, 1. 2, it does prevent osteoporosis. So it makes our bones stronger. Just the strain of the muscle on the skeletal system thickens the bones. 3, for muscle gain is muscle cells are some of the most insulin sensitive cells we have. And so insulin resistance is something we harp on all the time. And so if you can train your muscles and get them stronger, then your blood glucose will come down and we can prevent a lot of those issues. And then 4, it increases metabolism. So it's wonderful across the board. And better yet, it increases body composition, and people usually like how they look when they get more muscle. So it's an easy sell. It's not always easy to train muscle appropriately, and I think a lot of people find themselves a little lost when they're approaching this. So this is the area of exercise I would say if you're not super confident, if you don't have a lot of experience, if you don't think your form is great, my number 1 pearl is just get a trainer. 1 day a week, 2 days a week, really that's all you need to see huge progress. So that'd be my recommendation, is maybe 1 to 3 days a week of strength training. Another thing that often happens with strength training is you don't want this to turn into cardio, right? If your focus is strength for that day or for that workout, it should be strength. It shouldn't be circuit to circuit to circuit and your heart rate's at its maximum. Right now we've moved into our high intensity and we've lost the focus of that. And then 3 is just good form. 3, add the weight, good form, right? Getting injured, blowing out your knee, right? We have regenerative medicine, we'll fix it, but you don't want to do that because that defeats the purpose of exercise for longevity.